This photo, obviously, this was me. This was in 2015. We also have another firm, Africa, through which we do research, trainings, and all. And Africa was contracted by the African Union to evaluate their response to the Ebola outbreak across those 3 countries in 2015. Guinea, Liberia, and Sierra Leone. And we went there for 2 weeks. We went around those 3 countries, interviewing people, African Union volunteers, community people, international partners, ministries of health of the different countries to learn, what happened, what could have been done better, what were the key things that the African Union brought to the table, because they deployed the largest contingent, about 855 volunteers from several African countries. So interestingly, our first stop was Liberia. So this was Monrovia Airport. As we just disembarked, the first thing we did was to wash our hands in bleach water. This was bleach water. You disembark, you wash your hands. And we thought that was strange, really, coming from Nigeria, because this was close to the end of the outbreak. By the time we got to our hotel and now started having our meetings, we noticed that every building you entered, there was bleach water. You will wash your hands, have your meetings. When you come out again, you wash your hands in bleach water. When you were even traveling between communities, like every 20 kilometers or so, there was a big tank of bleach water with a military check. You have to stop, disembark, everybody wash their hands before they continue again. So it was serious business. Bali et al. 2016, they did a research about the outbreak in West Africa. What was the loss to GDP after this outbreak in West Africa? So Guinea lost $600 million in GDP because of the outbreak. Sierra Leone lost $1.9 billion. That's one of the poorest countries in the world. It lost $1.9 billion. Then Liberia lost $300 million in GDP. Nigeria, on the other hand, lost $186 million. That's small outbreak in Lagos. That's what we lost to that outbreak. So by the time we total everything, the Ebola outbreak in West Africa cost a loss of GDP of about $3 billion. For us, if we were prepared, that would have been a totally different thing. Those are the economic losses. But also, there were losses in human lives. By the time it was over, about 11,300 people died across these 4 countries. In fact, the World Bank did a research of the number of health workers that died. And they found out that as a proportion, health workers actually died more than people. As a proportion of health workers that died compared to the number of health workers and community people compared to the people that died, more health workers died as a proportion because of the outbreak. And one other thing that was quite evident was businesses closed down. Airports closed down. Airlines refused to fly. Arik, that used to go to Monrovia then to Freetown, they refused. In fact, because of that, we had to go, do like a merry-go-round before we got to, because the only airline that was even flying then that took us from Lagos was a chartered airline. And within those 3 countries, it was the UN aircraft that was flying people, from one part from one country to the other. Schools were closed down. In fact, schools were closed down for several months. In Liberia, for example, somebody started an NGO that was doing radio school. So they were doing school in radio so that pupils at home could keep track of what was happening. So this is how an epidemic can devastate a country. Nobody is safe, not health workers, not teachers, not hotel proprietors. Nobody is safe if it actually happens. Again, this is something that NCDC led with different partners. NABS 2018 is National Action Plan for Health Security. And the other side is the International Working Group on Financing Preparedness. They did a study and said, okay, how much? The NABS is a costed plan. The cost is that it's going to cost 40 cents per person to really prepare for epidemics in Nigeria. And we said, okay, with an estimated population of 200 million people, that means it's going to cost us about $80 million per year. That's about 29 billion naira per year. But look at it. If you spend $80 million per year, you're going to save $9.6 billion per year. Because that's the estimation of what would happen if there's an outbreak, like Ebola in Nigeria that is really widespread, Nigeria is going to lose GDP equivalent to $9.6 billion per year, about 3.5 trillion naira. And that's almost 50% of our national budget. So it's almost like it's a trade-off. Which one do we want to do? We've not even talked about the loss of lives. Just imagine if Mr. Sawyer came in through Zamfara. And again, not tell me it's not our portion. He could have come in through Zamfara. Because I think these are the things we need to think about and to realize that in a way we can say that we're not ready. And let me explain why. NCDC, WHO and partners also did the joint external evaluation to say, okay, how ready is Nigeria? They've done it for every country. And from that evaluation that was done in 2017, they said Nigeria was 39% prepared. After that, some things have happened, obviously, to improve our status. But I'm sure even if you do it again, probably it will be 50 or 60%. But for you to be prepared according to that evaluation, you have to score 80% and above. And for us at Nigeria Health Watch, we say that we are as strong, or let me even modify it a bit, we are as prepared as our weakest link. So as long as there are states, communities in this country that we don't even know what is happening there, our international borders, land borders, you know, they are just people's compounds, people's farmlands, people can walk in, we don't know what is happening, then we can say really, honestly, that we're not prepared. But however, I'm sure by the time we finish these discussions today, we get to hear some of the things that have been done, you know, by different agencies, different partners working to prevent this. So, the question is, are we willing to spend $80 million so that we don't lose $9.6 billion? And you know, the Igbo man in me just sees that this is a no-brainer. You know, it's pretty straightforward. We should. And for us, for the project we're running, Prevent Epidemics in Nigeria, what we want the president to know, I will have to give credit to President Buhari. He signed the NCDC bill into an act. He has released funds, all sorts of funds to NCD, but it's not enough. I mean, what was released through the BHCPF about 2 weeks ago is just a fraction of what NCDC needs to protect Nigerians. So we're saying, Buhari, for this second term, you must prioritize, because when it happens, businesses will close, people will die, economy will collapse, international partners will stop coming. We know how wide Nigeria is. And this is why the international community is kind of jittery. They don't want this thing to happen in Nigeria, because if it happens, it will be very difficult to contain.